Hi, my name is Brittany Kohrell. I am a BSN student here at Stanford University at the Riverside campus, and my signature assignment for Physiology 1040 is on heroin. Other clinical names for heroin do include diacetylmorphine, dimorphine, acetylmorphine, acylated morphine, and morphine diacetate. Heroin is an opiate derivative drug. It is known for relieving pain and is also promoting the sense of wakefulness or euphoria, as users call it. Heroin is highly addictive, and it did become illegal in the United States as a prescription drug in the early 20th century due to its highly addictive effects. Heroin is originated from morphine, and morphine is a derivative of the poppy plant, an opium plant, as you see here. There are a few different usages of heroin. Users can either inject, smoke, snort, or sniff the drug, although most users do prefer injection due to its rapid and fast-acting effects from injection. Those that use heroin have often had in the past other kind of substance issues or substance abuse issues with prescription opioids, even family history of the substance, depression, anxiety, environmental factors, and also high-risk individuals or environments can make one more susceptible to use of heroin. Although addiction is multi-faced with genetic, psychological, and environmental factors, anyone can be affected by heroin addiction. Anyone can become addicted to heroin. It does not matter the walk of life, financial, family income, or anything like that. It can really affect anybody. These are some street terms and slang for heroin usage or terms for the drug. This includes Big H, Thunder, Smack, Negra, Black Tar, Shiva, Hell Dust, Horse, and sometimes they call it Chasing the Dragon. In this image here, you can see this young female is using heroin by smoking it with aluminum foil and lighting the foil underneath with a lighter. This is heating up the substance, and she is smoking it through what would be an aluminum foil type pipe. When this is lit and heated up, it creates a smoke. So she is literally inhaling the vapor and the smoke from what is called black tar heroin, or as they like to call it. On the demographics involving heroin from the years 1999 to 2020, 143,000 people in the US alone died from heroin overdose or an overdose involving heroin. Mortality rate of over 19% of all deaths caused by overdose were due to heroin, and the use has doubled, especially in ages 18 to 25 over the last decade. Almost all users of heroin have been using another form, such as cocaine, opioid prescriptions, and nearly 45% of heroin users had been addicted to some form of opioid prescription in the past before using heroin. By 2019 to 2020, overdose-related deaths from heroin had decreased by almost 7%. Now, it shows in the research that this is probably due to the fentanyl-based market shift and also naloxone access. This is a nasal spray that actually can help save someone's life. They do not need to physically inhale this when experiencing overdose. Somebody sprays it into their nostrils. The quicker that you use this, the more likely that it is going to help save their life in the event of an overdose. But markets have shown that there has been more access expansion to naloxone during this period of time, especially with the fentanyl increase that has been going on in the past recent 3 years since the pandemic. Those who inject heroin by using needles also run a high risk of contracting viral infections such as HIV, hepatitis B and C, bloodstream infections, bacterial infections of the skin, interactions of the cardiovascular system, so the heart. And in the chart you see over here, by race and ethnicity, non-Hispanic whites are significantly impacted by heroin use with a 114% change. The annual household income I found interesting because, like we discussed before, It doesn't matter the walk of life someone comes from, whether it's low income, high income, successful, non-successful household. Heroin addiction does affect anyone and can affect anyone. With about mid-class, so 20,000 to just under 50,000 annual household income, 77% uh, change in heroin use, and this is in marketing skyrocketing increase of about 286% increase in heroin addiction and overdose deaths. We see the effects on the brain of heroin. So the synaptic cleft on the left is before heroin, and we see the dopamine receptors down here. We see the opioid receptors, GABA receptors, and then on the right, we see the synaptic cleft after heroin. So when heroin enters the body, the components of the opium bind to the brain's neuroreceptors, turning off dopamine inhibitors. So addictive opioids such as heroin increase release, also blocking the reuptake into the neurons after the release of dopamine. This is flooding the synapse at this point. So as we see in the right diagram, these dopamine are flooding. There's no turnoff. So the dopamine inhibitors are not functioning, they're not working. And this is turning off the pain receptors, giving this user of this drug a sedation or euphoria type feel. So this is how it affects the brain by flooding the synapse and shutting off any pain receptors, also preventing dopamine inhibitors, which would shut off the process of dopamine flooding into the synaptic cleft. How heroin affects the body on both short-term effects and long-term effects when using this drug. Short-term effects while they're using heroin include feeling lethargic, drowsiness, their heavy upper body and lower body extremities, so they may seem slumped over or kind of melted into wherever they're sitting, a couch, a chair. Also wakefulness and sleepiness. This is called nodding, where they seem like they're about to fall asleep and then they wake up, or they're doing that kind of rocking motion. The feeling of warm or flush during the rush sensation, so they may feel like their body temperature is elevated during this period of time. These effects are temporary, but heroin users, the first time they ever use heroin, that good feeling, as it's called or has been referred to as, when the brain synapse is flooding the dopamine is being flooded into the synapse, people often become addicted because of that first feeling of heroin when it's in their system. And they find themselves trying to chase this feeling, and it's never the same as the first time or the first interaction with it. But a lot of people become addicted after just one use because of that. Long-term side effects, of course, from heroin include deterioration of dental health. So their teeth may seem deformed. They may be missing teeth. Severe constipation, so they may not use the bathroom or have bowel movement or feel like they'll have bowel movement for several days. X-rated skin from scratching, so they may have these, what they call pick marks. They may have like what look like scabs on their face from picking or scratching at their skin during that whole process with heroin. Weakness, decreased sexual function, malnutrition, and of course a diminished immune system. A lot of people, they lose a significant amount of weight when they're using heroin frequently, daily. Long-term heroin users also, they can run a higher risk of virus-related illnesses such as HIV, AIDS, and hepatitis, blood infections, skin infections from using dirty needles that are shared amongst users. And we'll see in the next slide some of the images of people that have used heroin and how it's affected them. Here we see I provided some images of internal and external effects of heroin, including people that have used them. You can see on the surface how it's highly impacted their bodies physically on the outside, but also inside. Brain damage, addiction, overdose, we talked about with dopamine flooding the synapse, watery eyes and reduced vision, the nostrils, if they snort it, irritated nostrils. so scabbing, flaking, bleeding even. The breathing may stop and they maybe need put on a ventilator and they're in a coma due to this. Heart infections, as we talked about, it does affect the cardiac system. Infections such as HIV, hepatitis, like we talked about, of course. This is run risk, especially when they're injecting and using needles that have been used by other users, or just dirty needles for that matter. Loss of appetite and vomiting, as we talked about, they have a significant weight decrease when they use it periodically or every day. Hepatitis, liver damage, bruising, sores, infections, and blood clots. So bruising, if they inject it, a lot of places or popular places they will inject the drug is in the arm, sometimes in between the fingers or the knuckles, in between the toes, back of the foot, on top of the foot, anywhere that they can find basically a vein, or they feel that they will drug into their system faster. Also including behind the ear. Abdominal pain, nausea, constipation, as we talked about, and of course, pain in the bones and muscle cramping are also other effects that has internally on the body. Here we see some, it's very sad, I'm sorry, but how young these people are, and it does age you from the inside out. One woman, 29, and here she is, 31 years of age, and she looks like she's aged another 10 years. A woman here, 22, and in the right picture, she can't be too far off from the age she was, but sadly, this is what it does to your body. We see another woman, age 22, and then here she is, age 23, and a gentleman, 34, and now 40, and you can see there's some dental deterioration, as we talked about in the previous slide. Women can have miscarriages, stillbirths, and birth defects if they're using while they are pregnant as well, which sadly is a thing that does happen. But yeah, it is all very sad and how it affects them and these young adolescents, especially when we talked about the increase between ages 18 to 25. It's almost doubled in the last decade regarding this drug. When it comes to diagnosis and treatment, first thing you know is recovery is possible. Of course, like any addiction, especially with opioids, heroin, the first step is wanting to get help. Most addicts don't want to get help because they are so addicted to it, because it is a very highly addictive drug. As we talked about before, it has been illegal in the United States since the early 20th century. It was originally used to relieve pain. I have attached here a national helpline that provide free and confidential access to resources and treatment. A lot of the states in the United States now follow the Good Samaritan law. So if you see a loved one struggling with or, physically coping with addiction, you can help them get help. Right here, we see treatment for those struggling include medication assisted therapy, or MAT. This is a doctor prescribed medication such as methadone, buprenorphine, and naltrexone, in addition to behavioral therapy and counseling as well. The woman above right here in this image, this was her when she was battling addiction with heroin. And in the right image here, she is now in recovery since 2018. She's been clean and sober. If you want to see more inspiring photos, of course, you can click the link below. But prevention for overdose is also another significant way we can decrease the mortality rate of heroin overdose by better access to naloxone, which, as we talked about, was the nasal spray. Also being available, standing availability in pharmacies, community organizations, including law enforcement as well, being able to access it when on the scene of someone possibly experiencing an overdose. This can save somebody's life the quicker it is used by administering it, and thereby decreasing the rate of death due to this drug. So I encourage you, if you know somebody or a loved one struggling with this, check out this free advice helpline. The first step is getting help, but sometimes it takes an act of love. And this is just a slide I included. Celebrities that have lost their lives from heroin or heroin-related deaths Also, those that are in recovery. I found this interesting because, a lot of people, we see Hollywood and, we understand that there are things that go on, but it is good to see that there are people that are in recovery, but it is also sad to know that there are young lives that can still be lost from this addiction. This, of course, includes Kurt Cobain of Nirvana, Janis Joplin, both dying in heroin-related incidences. If you want to pause the video and read about any of these, more than welcome to. I just put this in as a little extra something for you. Of course, celebrities in recovery, because recovery is possible. Angelina Jolie and Steven Tyler. But yeah, I found this quite interesting and sad at the same time, but just to show you that it does affect everyone. It does not matter race, ethnicity, age, income. It is an addiction that can affect anyone. And these are my reference slides of images, sites, and book that I've used for my research in my signature assignment. My name is Brittany Kohrell. I am a nursing student for my RN BSN at Stanford University, and I thank you for your time today. And I hope you have a good rest of your day. And remember, recovery is possible. Thank you for your time.